Hello, Ken Barron here with the National Association of Black and White Men Together. Today's topic: Medicare will require prior approval for certain procedures. You can pay more for traditional Medicare, or you can opt for a plan offered by a private insurer and risk drawn out fights over coverage. Patients are leery and think it's the back door to privatizing traditional Medicare. Private insurers often require a cumbersome review process that frequently results in the denial or the delay of essential treatments that are readily covered by traditional Medicare. The Centers for Medicare and Medicaid Services plans to begin a pilot program that would involve a similar review process for traditional Medicare, the federal insurance program for people 65 and older, as well as many younger people with disabilities. The pilot will start in 6 states next year. Hmm. The federal government plans to hire private companies to use artificial intelligence to determine whether the patients will be covered for some procedures like certain spine surgeries or steroid injections. Similar algorithms used by insurers have been the subject of high profile lawsuits which have asserted that the technology allowed the company to swiftly deny large batches of claims and cut patients off from care in rehab facilities. The AI companies selected to oversee the program would have a strong financial incentive to deny claims. Medicare plans to pay them a share of the savings generated from rejections. The government said the AI screening tool would focus narrowly on about a dozen procedures which it has determined to be costly and of little benefit to patients. Abe Sutton, the director of the Center for Medicare and Medicaid Innovation, said the government would not review emergency services or hospital stays. He said the government experiment would examine practices that were particularly expensive or potentially harmful to patients. This is what prior authorization should be, he said. The government may add or subtract to the list of treatments it had slated for review depending on what treatments it finds are being overused, he said. People enrolled in traditional Medicare who live in Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington State will be included in the experiment, which is expected to start in January and last for 6 years. It's basically the same set of financial incentives that has created issues in Medicare Advantage and drove so much scrutiny. Typically, these models scan a patient's record to determine if a requested procedure meets the insurer's criteria. For instance, before authorizing back surgery, the system might search for proof that a patient first tried physical therapy or received an MRI showing a bulging disc. Insurers defend these tactics as being effective in reducing inappropriate care, such as by preventing someone from getting back surgery at tremendous cost instead of another treatment that will just work fine. Government officials said any denials will be done by an appropriately licensed human clinician, not a machine. A group of House Democrats warned in a letter to the government officials in late July that giving for profit companies a veto over care opens the door to further erosion of our Medicare system. Private plans under Medicare Advantage have become increasingly popular, with a little more than half of older Americans and people with disabilities eligible for the program, and some 35 million have enrolled. But many are willing to forego some of the additional benefits the private plans offer, like dental checkups and gym memberships, to avoid having to jump through numerous hoops to get care. The American Medical Association wrote in a letter that doctors view prior authorization, quote, as one of the most burdensome and disruptive administrative requirements they face in providing quality care to their patients. Most patients who appeal are successful, but a vast majority never appeal. In announcing the new model, Dr. Mehmet Oz, the administrator of the Medicare agency, said the goal was to root out fraud, waste, and abuse. Where have we heard that one before? But if the algorithm used to authorize these procedures proves to save the government money, CMS may feel justified in broadening the program to include services that are not such, quote, low hanging fruit. How insurers make decisions remains opaque. A spokesman for Health and Human Services, which oversees the Medicare agency, declined to identify which companies had submitted applications for the contract. Contractors hired by the government are supposed to watch over payments to ward against any inappropriate or wasteful coverage. These reviews generally happen after someone has received a treatment. The new model relies on an additional set of private companies for traditional Medicare that have a very clear incentive to deny care. The companies represent a whole new bounty hunter, one of the groups that has urged government officials to abandon the program says. Well, that's happening on the horizon. Let's hope it doesn't really happen because a lot of people rely on Medicare, especially those that are older or disabled. This is Kim Barron. I'm with the National Association of Black and White Men Together. Remember, we have a convention in Las Vegas next year, and go to nabwmt.org in order to register. We appreciate all your information you provide and the help, and hope this has helped in some manner. Thanks a lot for listening. We appreciate it.